Good morning. I'm Michael Amiridis, Chancellor of UAC, and it's my pleasure to welcome you to our annual Urban Forum. I would like to begin by thanking Cook County Board President Tony Preckwinkle, who for another year is serving as my co-chair for this forum. President Preckwinkle has been a strong supporter of the event, and we appreciate her advocacy for public higher education and for UAC. I also want to extend my gratitude to the Institute for Policy and Civic Engagement in our College of Urban Planning and Public Affairs, CAPA, as we call it, for organizing this gathering. And of course, I want to thank all the panelists and participants in this year's events, with a special welcome to Grace Hall, the Secretary of the Illinois Department of Human Services, Dr. Julie Morita, the Executive Vice President of the Robert Wood Johnson Foundation, and Lisa Lee, the Executive Director of the National Public Housing Museum, and a faculty member in our School of Art and Art History, one of our own. UAC has a long and well-documented history hosting annual events on important urban issues of the day, beginning with the Winter Forum in '96, through the Richard J. Daley Urban Forums between 2005 and 2010. The concept and the format were revitalized in 2011, and the UAC Urban Forum was established and continues to serve its purpose, to bring together people from the community, the academy, nonprofits, government, and the private sector as they discuss critical challenges and developments facing our society. Past topics have ranged from housing and employment to transportation and autonomous vehicles. This year's title, Urban Resilience and Inclusive Recovery, could not be more pertinent. If there is one thing the COVID pandemic has brought into the light more starkly, these are the disparities from healthcare to economic impact that are embedded within our system. I took a look at some of the statistics that we have all read or heard in the news over the past 2 years, and the issues are deeply concerning. The disparities in how the pandemic affected communities varied greatly, and the hardest hit were communities of color, both in the healthcare and the economic issues, which are the topics that will be discussed today. We have seen these issues firsthand at UAC. Over the last 2 years, we have received hundreds of emails and voice messages from students and families who lost their jobs or lost part of their income, who could not keep up with the cost of college, and who suffered the devastating effects of COVID on their health and the health of their families and communities. The majority of our students come from historically disadvantaged groups. Many are children of immigrants, and many are first-generation students, the first in their families to attend college. They have been in a uniquely vulnerable position with their health care and with their economic situation. And because of long-standing disparities, low-wage workers, people of color, and women have suffered disproportionately in the combined medical and economic crisis. Last year, the UAC Urban Forum focused on closing the wealth gap. Now, a year later, with the city and the country coming out of the pandemic, the focus on recovery has risen to prominence in the local and the national agenda. This is the time we need to come together to discuss how this recovery can be inclusive and how cities can rebuild and at the same time lift everyone up. Thank you again to everyone who is participating, and I hope that the outcome of today's conversation will have an impact in the lives of the people we serve here at UAC, in the city of Chicago, and throughout the world.
Hello, this is Tony Preckwinkle, President of the Cook County Board of Commissioners. It's my honor to help welcome you to the 2022 UIC Urban Forum. Special thanks goes to University Chancellor Michael D. Amiridis, Program Director Joe Horath, and all of the staff at UIC and their partner organizations for making today's event possible. Urban resilience is the theme of this conference, and resiliency is something we know a lot about in Cook County. Throughout the pandemic, our bureaus, particularly Cook County Health, have been at the forefront of the county's response to COVID-19. We directed them to provide the best possible care to anyone who walked through their doors without regard to their ability to pay. And they did it admirably. When we talk about health equity, this is what we mean. Without a public health system like Cook County Health, there's no telling how many lives would have been lost during the pandemic. Now, with the support of President Biden, we can use American Rescue Plan Act, ARPA funds, to continue and expand on the work we started during the pandemic. With bold and ambitious initiatives like the Guaranteed Income Pilot, abolishing medical debt, and investments in behavioral health services, Cook County will be a national leader in increasing equity and decreasing disparities. We look forward to continuing to work with you in creating a county we're all proud to call home. Thank you.
Thank you, President Preckwinkle, for your remarks. Hello, I'm Joe Horath, Director of the Institute for Policy and Civic Engagement in the College of Urban Planning and Public Affairs, and the Program Director for the Urban Forum. My institute has been a supporter of the Urban Forum since 2010, and I'm proud to be in this role following the retirement of Dean Pagano last year. The Chancellor described the history of the Urban Forum, and before we begin, I wanted to take a moment to acknowledge the passing of one of our dear colleagues, last year's Urban Forum Program Director, Janet Smith. For a quarter century, Janet's teaching, research, and community service focused on equity issues in housing, planning, and policy. Her research and outreach activities were regularly conducted in partnership with community organizations and policy stakeholders through the Voorhees Center at UIC. This influence went far and wide, but she also served this event as a program director and a white paper author. As one of her colleagues said, her commitment to the principles she consistently espoused, social equity, community voice, and valuing community-driven solutions to enduring urban problems, is testament to her enduring influence on urban planning and policy. Her spirit lives in this year's theme, and future Urban Forum theme events will share her commitment to equity and social justice. As we heard from Chancellor Emeritus and President Preckwinkle, the intent for this year's Urban Forum is to use this space to inspire ideas, dialogue, and action that lays the groundwork for eliminating disparities that left communities of color much more vulnerable to the impacts of the COVID-19 pandemic. We have two great panels set up for today, one that addresses the perspective of individual and community health, and a second from the perspective of the economy and the built environment. Our first panel is titled Lessons Learned from the Pandemic: How Can We Eliminate Urban Health Disparities? The moderator is WBEZ Health and County Government reporter, Kristen Schorsch. She has covered healthcare, government, crime, courts, higher education, and even news of the weird for Crain's Chicago Business, the Chicago Tribune, the Daily Southtown, and the Iowa City Press Citizen. Kristen has won more than a dozen local and national awards for her work. Her stories have sparked policy changes and spurred investigations. I will now turn it over to Kristen to introduce the panel topic, our fantastic panelists, and to get the conversation started.
Hi, good morning. Thank you so much for joining us. We're going to have a great discussion today all about what the pandemic taught us so that we can learn how to eliminate health disparities now and going forward. Before we get started, just a reminder, there's a box at the bottom of your screen. Please drop your questions into the chat and we'll get to those after our panel discussion. Now into the conversation. Each panelist is going to briefly introduce themselves before we get started. And we can start with Grace Hope, please.
Good morning. Thanks, Kristen. It's good to be here with all of you. My name is Grace Ho, and I'm the Secretary of the Illinois Department of Human Services, and it's truly a pleasure to be on this panel and have this conversation with Dr. Morita as well as Dr. Walker. our paths have crossed in over the past several years and beyond, and both of them have been really, really helpful to the department as we battled against COVID. So really appreciate being in this space. So what does it mean to be the Secretary of the Illinois Department of Human Services? I joined the Pritzker administration in 2019 after having spent almost 7 years in philanthropy at Woods Fund Chicago. And previous to that, I was assistant secretary here at the Illinois Department of Human Services. So this is what I call my second stint in state government. And it has been deeply, deeply fulfilling, terrifying, I would say, especially after the past several years. We certainly didn't sign up to fight the pandemic, but I'm truly grateful that we have the leadership of our governor and all in his cabinet alongside me who have been working diligently and tirelessly to protect the people of Illinois. So what does it mean to be the Department of Human Services? And I think as I reflect on the pandemic and all that we did, I think what I realized is that the COVID-19 pandemic made it so that we had 0 degrees of separation from our neighbors and communities and people across Illinois. You know, we did not have the luxury of being able to say that's their problem and it's not my problem. I think the Department of Human Services, our work has always been deeply compelling. We serve 1 in 3 people in the state of Illinois. We have psychiatric hospitals, developmental centers. Most of our $12 billion budget goes to community providers and neighborhood organizations across the state to meet the needs of people who have disabilities, people who are hungry, people who are struggling financially, people who are looking for gainful employment despite their disabilities and challenges, people who are looking for medical insurance, childcare, after-school programs, a safe harbor because of domestic violence in their lives, immigrants and refugees who are looking for welcoming neighborhoods and welcoming states. That is who the Illinois Department of Human Services is, and that is what we have been over the past many years. And COVID-19 has deeply challenged us, I would say, but it has also, I think, propelled and spotlighted the work of not only social services and human services, but the work of government. And I think, you know, that is one of the things that all of us have in common. Dr. Morita, Dr. Walker, we have all in various ways dedicated a good number of our years in government because we believe, I think, in the power of it. And the last thing that I would say as an introduction to the work and the discussion at hand is that government is important. And it is, you know, during the course of the COVID-19 pandemic, in the darkest days when we were really trying to redesign a new human services system overnight, was that if we failed, there is no one else behind us, you know. And so in that way, we knew that we had to be relentless in our pursuit of the system, despite what I think many people thought that we might not be able to achieve. But we were, I think as a state, truly impressive in our response. So I'm happy to be a part of this discussion.
Thank you. And Dr. Morita?
Thanks, Kristen. Good morning, everyone. Grace, it's just an honor to be joining you today, and also Dr. Walker. I think your points about the importance of government really are necessary to lift up and highlight, because I think without government, there would have been no response. And I think you all played a critical role in it. So it's just really an honor and a privilege to be joining you today. So for folks that don't know me, I'm Julie Morita. I'm the Executive Vice President for the Robert Wood Johnson Foundation. And Grace and I really flip-flopped, because while Grace was working in philanthropy and then joined government after or just before the pandemic, I had been in government in Chicago Department of Public Health for nearly 20 years. And just before the pandemic, and then joined the Robert Wood Johnson Foundation at 8 months before the pandemic. And so had been deeply involved with governmental public health responses for public health emergencies over the course of the years. And what Grace has really highlighted is really the important connection between human services as well as public health. I think that is one of the key things that the pandemic has really made clear, is that there really is no separation, and shouldn't be a separation, between public health and human services. There just needs to be this really incredibly tight link. But before I start talking about that a little bit more, I really wanted to just describe a little bit about what the Robert Wood Johnson Foundation is. We are the largest foundation in the nation focused solely on health. And we are committed to building a culture of health grounded in health equity, which really means building an environment in this a society where everyone has a fair and just opportunity for health and well-being. And the pandemic has really made clear that the greatest barrier to health equity is really the systemic and structural barriers to health. And structural racism is really at the top of the list. So that's why Robert Wood Johnson Foundation has really doubled down on health equity by focusing on addressing barriers to health, including racism, other forms of discrimination, and the social conditions that impact health. And that is really the most important role for RWJF to play as we try to build a culture of health and really improve health throughout our nation. So that is what the Robert Wood Johnson Foundation is really all about. Prior to joining the foundation, though, I did spend 20 years at the Chicago Department of Public Health, where we focused on really looking at where my responsibilities primarily related to addressing and preventing infectious diseases, particularly in our underserved and marginalized communities, and spent the majority of my career working on those things, and had a lot of experience working in things like H1N1 pandemic, which really seems like a little tiny public health crisis versus what we experienced most recently, but also things like Ebola and Zika and measles or meningitis outbreaks over the course of my career. So because of my work with RWJF and then also the prior work that I did at CDPH, I was asked to serve on the Biden COVID-19 transition task force, where we were really charged with guiding the transition team, their development of the response plan, so that after inauguration, the Biden administration had a plan moving forward. And what I was thrilled to really be a part of was that we were challenged to really focus on using evidence and science to inform our recommendations and our input, but also that we were really to prioritize equity. And from my perspective, one of the key things that's really played out well from the pandemic is that there's a clear acknowledgement and need for us to really look at the equitable aspect of our responses to make sure that public health responses and measures and interventions really do address the communities most affected and the people who are disproportionately impacted by the epidemic itself. And what that lifted up was this need for us to address structural barriers to health, including things that are preventing communities of color, low-income communities, rural communities from really thriving at baseline and then also during pandemics. As Grace mentioned, we've worked in the past together when she was in philanthropy and I was in government, but then again, now into the flip, during the pandemic, I was actually able to help with the state's response as well. So supported IDPH in some of the early phases of their response, and was really thrilled to have the opportunity to step back into government and to assist. So I think this conversation that we're having today is just really, really important and critical, and I'm glad to be a part of it and look forward to engaging with you all in the discussion.
All right, thanks so much. We're having some technical difficulties with Dr. Walker. We hope to have him on soon, but I think we can just get started with our conversation. So to lay the foundation for this panel discussion today, let's start out with briefly explaining what health disparities were revealed during the pandemic. What did this look like? Dr. Morita, I was wondering if you could walk us through that.
Sure. I mean, I think from the early phases of the pandemic, it became clear that there were certain communities that were being hit most hard by the pandemic in terms of who was getting sick, who was hospitalized, and who was dying. And those communities are the same communities that we've seen experience disproportionate impact with other public health emergencies. So it was our communities of color, our low-income communities, some of our rural communities. And what I thought, I mentioned it earlier, but I feel like it's really important to lift up is what was acknowledged more so now this time than any other time was that it wasn't because of some physiological problem with these individuals or these communities, but more that it's the systems and structures that were in place that really prevented people from taking care of themselves, taking advantage of some of the preventive measures that were put in place. So people who couldn't work from home were at greater risk. People who didn't have access to health care services were at greater risk. People who were dependent on public transportation or were living in crowded housing were all much more likely to become sick and also to be hospitalized and to die. And so it really lifted up this connection between some of the social needs of our communities and their vulnerability when the pandemic or another public health emergency arises.
Kristen, we can't hear you.
Apologies, I muted myself there. I love the virtual conversations we have during the pandemic. Dr. Walker is here, and I just wanted to give him a chance and opportunity to introduce himself before we move on.
Hello, everyone. It's so wonderful to be here as well with so many familiar faces, and my apologies with the technical difficulties. Especially, my name is Garth Walker. I'm from Chicago, Illinois through and through. I grew up around the Hyde Park area. My background is in emergency medicine and public health. So I am currently serving as a White House Fellow working for the Surgeon General. Prior to this, I served as the Deputy Director with Illinois Department of Public Health, where we did some amazing work, especially with Secretary Grace Hughes' leadership, as well as Assistant Professor at Northwestern. Most of my research, as well as my initiatives, has focused at the intersection of social determinants of health and healthcare access and affordability. It's an honor to be with you all today. And if I could just say a few words about the pandemic, one of the biggest issues that we learned during that time was just how important healthcare disparities is, and as well as health equity. I think it really shone a light on it, and it really allowed us to center our perspectives and try to really understand what really matters and who we need to prioritize. So I'll stop there, and I'm thankful and happy to be part of this panel.
Okay, thanks so much. Dr. Walker, I was wondering if you could talk about this a little bit. When the pandemic hit, you were treating patients in the ER. You had a new baby at home. You decided to briefly move out to protect your family, which I heard from a lot of people early in the pandemic. What can you tell us about those early days of COVID-19? Like how you saw glaring health disparities firsthand among patients you treated, but even among, your own circle of friends, family, neighbors?
Thanks, Kristen. I think when I think back to that time, I mostly think about the uncertainty of what many of us were dealing with, especially as physicians. We're used to working in settings that are traditionally safe when we're trying to care for a patient, and we often want that context to be a safe space to be able to connect with our patients and be able to prescribe the best plan. When the pandemic hit, I had a newborn and made the decision, like many other people, to move out and try to protect my family. But I also come from a very privileged background, and I have the means and I have the opportunity to be able to do that. And many of my friends and many of my patients don't necessarily have those options. So dealing with that very real reality provided a very difficult circumstance as emergency physicians to be able to deliver care in ICU and primary care docs and the like. One of the things that I think is most important to realize is that as a physician, that's probably the easiest part, diagnosing and trying to figure out what are the next steps. But the most difficult challenge is discharging a patient from your ER and discharging them to an environment that, frankly, we don't have as much control. And so when we're talking about physical distancing, social distancing, trying to get the best information available, many of our patients don't have that privilege. And trying to work in that circumstances changes the clinical decision making often. And that was hard to be able to communicate to many of the patients that I dealt with.
And you wrote this really powerful op-ed in those early days too in the Sun-Times, where you really pointed out that Black people in particular cannot socially distance, right? Can you talk about what that op-ed said, but what prompted you to write it?
Yeah, I think it was mostly it was a very emotional piece, very charged emotionally. And I think it was just a culmination of all the drivers that were making it difficult for communities of color to get good care. And when you look at the south and west side of Chicago and you juxtapose that with the history of intentional racial discrimination born from policy and how many of those healthcare disparities still play out today, and you see it in the full front from the COVID-19, it was just a very frustrating time period, and I just felt the need to be able to write that and illustrate that. And I think myself and many others and many leaders throughout the state of Illinois and across the nation highlighted healthcare disparities and equity. And as a result, we've seen many new discussions of how we prioritize equity, how we implement that in the structures from a grant making perspective, federal perspective, and also even in environments that do influence access to care, like businesses and representation in many facets of life that influence people's ability to get quality healthcare.
Mm-hmm. Okay, thank you for that. Okay. Now, Grace, you lead an agency that at its core is people focused. And I know you talked about this in your introduction. DHS being a big funder of community health centers, after school programs, lots of different things, right? And all of a sudden, being in person was a massive risk of getting and spreading COVID. When we were preparing for this conversation, you mentioned that there was a board and there was a quote on it that said, if it's impossible, we still have to do it, meaning the government, right? Can you explain how you pivoted and what that was like? I remember it was just, everything was so fast-paced during those early days of COVID.
Yeah, that's right. So in early March, we wrote on my whiteboard here that's a phrase that says, it's still on there, if it is impossible, then we have to do it, right? I think that we immediately recognized that we had to upend the way that we do things to make sure that what we do is retained. And I would say that we had a lot of support from the federal government. As I mentioned, we're the front door for Medicaid insurance, as well as for supplemental nutrition assistance, for WIC, women, infant, children, family case management. And the federal government, I would say at that time, really enabled us to utilize waivers so that we could continue to provide support to families across Illinois in virtual ways and more flexible ways. I think on the other piece, with the leadership of our administration in Illinois, one of the first decisions that we made in the very early weeks was to make sure that we preserve and retain our community-based network of providers across the state of Illinois. So as I mentioned, most of our budget goes out into communities through nonprofit organizations to provide that care into communities. And we need to give them the grace in a very short amount of time to really pivot and figure out how they could provide services to their constituencies as well. So, when I gave my introduction, I feel, I reflect on kind of COVID, and I reflect on structural racism and the inequities that we're talking about. And, the notion of 0 degrees of separation with COVID-19 really forced us not just to look at the light of inequity, but also to be drawn to it, to actually address the issues, because those lives were actually linked to our lives. I think similar to Dr. Morita, our organization, the Department of Human Services, and why I was drawn to come back to government is because I wanted to build an anti-racist government organization. And I think it's important to name that. I think as I reflect on the Department of Human Services and our mission, which is to provide services and supports to people in communities, I sometimes think that when we are really effective, we are actually able to conceal structural racism, because we give just enough food, we give just enough, a little bit of cash assistance to kind of provide a superficial salve on what is deeply rooted in the policies and the historic racism, which is, important parts of the fabric that we have woven over time. And so we have to not only provide what people need here and now, but also examine our institutions to kind of undo the things that continue to marginalize people. And during COVID-19, I think we had to do the impossible, not only because we were a government. And I think the other piece is leadership matters. Who sits in our seats matters. Who sits in the Capitol and members of the General Assembly matters. And I think that we can be compelled to do things of our own accord because we have different levels of power in our own institutions. But at the end of the day, we are accountable to the constituency of people of Illinois. And I think COVID-19 gave us the public will to do all that we could to keep people safe because our lives were tied to each other. And if we are going to kind of capture the lessons into the next chapter, we will continue to need that public will in addition to strong leadership in government to do what people hope and expect that we will. It's not going to come naturally or organically. We're going to continue to need the encouragement and the demands from the constituency that we treat inequities like the virus that was COVID-19 or that is COVID-19.
Okay, thank you. And just a reminder for the audience, if you want to drop your questions in the chat box at the bottom of your screen, and we'll get to that after our panel discussion. So Dr. Morita, you were on President Biden's COVID-19 task force when he came into the White House. I'm wondering, what did you want to see changed from the previous administration when it came to tackling disparities? I mean, can you share anything about how you pushed for change, what you pushed for, just to give us a little sense of that?
Sure. I mean, I think what we've talked about this morning thus far, and has been acknowledged throughout the pandemic, is that these health inequities and health disparities that were lifted up and underscored during the pandemic have existed for a long time. So these are not new. And it is because of these systems and structures that have been put in place for many, many years, for generations. And that's why we have these things playing out with every public health emergency that occurs. So what thrilled me actually about being asked to participate on the task force was that there was this emphasis on equity from the very beginning. That was our charge. That the constitution of the task force was made up of a wide variety of levels of expertise, from governmental public health people to academics to people who had really focused their careers on health equity. And there was this broad range represented. But one of the co-chairs was Marcela Nunez-Smith, who's done a bunch of research on health equity and really was charged to be a lead, and then took over and became the health equity lead for the administration for the response. That kind of commitment was unprecedented from my perspective. I've been through a number of public health emergencies at a national level, and there'd never been this acknowledgement for the need for us to focus on health equity. And so the conversations that we had were really always taking into consideration, are we really reaching those who have the greatest need? Are we really reaching those who have had disproportionate access or disproportionate impact? Have limited access? Are we really meeting those who have the greatest need? But we started with conversations about where are the deficiency in the information that we have? Are the data high quality? Because one of the biggest challenges that we noted early in the pandemic was the data related to race and ethnicity disaggregation was really poor. It's very inconsistent throughout the nation. From a state, within a state, even just different locales had different quality of information and different quantities of information. And so really lifting up that as a critical need to really have the essential and necessary basic information to really know who is being impacted and being able to direct the resources to those communities and to those people. So one part of it was really identifying, having the right data. The other thing that we really highlighted and pushed for was the focus on engaging with the communities that are most affected. That it's not enough for top down for government officials or for philanthropy or for other private sector organizations to come to community and say, this is what you need, this is what you need to do, this is how we're going to do it. But really engaging with community at the get-go to say, we need to understand what you're experiencing, we need to understand what the barriers that you're facing, be a part of the conversation, be a part of the solution building. And we saw resources flowing from government to communities to actually be able to engage more meaningfully and more authentically, to hear from community what the needs were and how to develop solutions. And because of my past record with Chicago, I was able to stay in touch with the Chicago Department of Health pretty closely, and so was aware of a lot of the activities that were happening in Chicago related to their racial equity rapid response teams, which really focused on engaging with community organizations to really make sure that the testing, the contact tracing, the vaccination efforts were really informed by the communities who are being disproportionately impacted. Those kinds of solutions are really, really important, and those approaches are really necessary to make sure that the needs of the communities are actually being met. And so Early on in the pandemic, the foundation put together some health equity principles for health officials in their response and also in recovery. And number one on the list was making sure that disaggregated data were available. And number two on the list was really making sure that the communities that were most affected were really part of the decision-making and the solution building as we move forward with response and recovery. And so I think those are really critical elements that we lifted up in the advisory task force, and I'm seeing play out with the ongoing response as well.
Okay, thank you for that. So what was a key lesson learned during the pandemic about disparities, particularly in marginalized communities? I know each of you has a really deep background in this, so I'm wondering maybe what a new lesson or two was learned. Dr. Walker, could you start with that?
Sure. I think to the earlier point, just the importance of being proximal to the constituents you serve, proximal to where the real problems are, and trying to make sure that you have an open and trusted relationship with those communities to be able to elicit the best solutions to move forward with. I think there are clear structural issues, and a lot of initiatives have been put in place to make sure that grants were equitably distributed, and then evolving conversations about how we diversify a workforce and a medical workforce, which are more long-term solutions. But in the end, it's the relationships that you build at the community and local level that can allow you to be very efficient, pivot very quickly, and try to elicit the best information available to come up with great solutions. One of our initiatives was partnering with organizations for marginalized communities, Black fraternities, churches, the Elder Men's Basketball League, which was 65 and up, which were trying to lead the charge in terms of trying to get their communities vaccinated. And partnering with organizations that may not be reflected in government as widely, and partnering with leaders in the Latino communities or the refugee communities, and making sure that their leaders are centered and have a platform to be able to deliver the best information possible, as well as get the scientific information. And I think a lot of the questions that we received weren't technical, but a lot had to do with just where to go, how to get it, why is it important for your family. And I think being able to develop a report early before a pandemic actually comes to your front door is the best step that you can take as a state to be able to avoid this from happening again.
Thank you. And Grace, how about you? What were some lessons learned that were perhaps new to you?
I mean, I would say that they weren't necessarily probably new to us as people, but new perhaps to institutions. And I think that some of the flexibilities that I had shared earlier on the federal, but then also on the state front, as it relates to the freedoms in some way that the disaster proclamations gave us to tap into some of the organizations that Dr. Walker had just mentioned, which I think historically have not been able to access state funding or federal funding for various ways. And it's not to say that we were making decisions irresponsibly without accountability, because we certainly were. But the crisis and some of the easing of bureaucracy enabled us to engage in very thoughtful partnerships, in particular with faith-based institutions. I think we are very cognizant, and I think the other piece of it is that the Illinois Department of Public Health was very, very, I think, committed to capturing data, which is like the first domino to fall in terms of making sure that we understand who is being served, who is being impacted, and who is not being served, and that can drive decisions. And so that very first piece under the leadership of Illinois Department of Public Health was critically important to open up the eyes to make sure that we knew what was actually happening. And so, we were able to engage in community-based partnership with faith-based institutions. They have a level of, I think, respect and credibility with community partners that government and some other organizations have since I think eroded over time. And so we were able to rebuild those relationships. And I absolutely agree with Dr. Walker that we need to hear from and follow those voices who we are trying to benefit, which is critically important. And I think the other piece that is important that I think was actually somewhat new to me was that we need to invest in robust communications and public relations and public education. We were able to use some of the funding that we had to engage with public relations firms, like professional, full-time PR professionals. And that feels somewhat like a luxury in government. But I think what I realized is it is not a luxury. It's life and death. We were sharing critical information about how individuals and families and neighborhoods could keep themselves safe. And if they didn't receive that information, it is dangerous, right? And so we engaged, I think it's several PR firms, not to provide kind of overarching macro messages, but to actually reach deeply into communities and say, what are the channels that you're listening to? Who are the credible messengers that you will pay attention to? And so we made the decision to engage with like Black-led PR firms, and I think Dr. Walker was part of some of that work with us. He was one of our credible messengers. We engaged in PR firms that had expertise in culturally and linguistically appropriate messaging to multilingual and multicultural communities. And so that for me was a lesson learned, and I think an area of government that we previously were not necessarily encouraged to do, which is to engage in deep and professional and robust communications that was, I think, very much customized to different communities.
Okay, thank you. And Dr. Morita, what about you? Considering your deep background in disparities, what were some lessons learned, especially, in terms of how COVID had marginalized communities?
Right. Yeah, I think throughout this pandemic, I've often thought about the quote of Einstein's, which is about with every crisis comes great opportunity. And I think it's a pattern that we see, that there's these cycles of funding that surges when there's a crisis, and then a lot of innovative, creative things and solutions come into play that are really beneficial. But then as the funding goes away, those kinds of activities fall apart, and the programming or the policies don't last. And I think in this particular situation, I feel like there were at the federal level, there were some really critically important policy changes that were put into play that give us a glimmer of hope in terms of what could actually happen if we made these kinds of investments long term. And so there were things like paid family leave, medical leave, incentivizing companies to actually provide leave for their employees. There was affordable quality healthcare was improved through expansion of Medicaid incentives, increasing tax incentives for the marketplace, enhanced eviction moratoriums, and there were just a number of different things that include expanded nutrition services. There were a number of provisions that were put in place through the pandemic that really helped lift some folks out of poverty, which is truly remarkable. That through the expansion of the child tax credit, we were actually able to lift millions of families out of poverty, which is truly unprecedented. But the problem with it is, as with federal funding for public health responses, you get these kinds of policies that are very temporary and they don't last. And what we really need is for these kinds of programs and these policies to be sustained, so that at our baseline, everyone in America has a better chance for good health and well-being. And when the next pandemic comes along, we're at better state, so we don't have to scramble to put in these emergency kinds of provisions, but people are just living at a higher standard to begin with. So these paid family leave, medical leave, living wage, affordable quality healthcare, childcare, housing, these kinds of things, we need to lift everyone up, and we can do it because you could see that through some of these American Rescue Plan Act provisions and some things that have been initiated because of the public health emergency nationally. We've been able to lift people up, but then these provisions have fallen down, and I'm concerned. Universal school lunches are going to end. Medicaid incentives and the ability to keep people retained in Medicaid. When the public health emergency ends, we lose that ability to keep people in Medicaid and allow them to have access to healthcare services. These kinds of things will end with the end of the public health emergency. And I think what we need to do is think about what we can do to really sustain these kinds of policies and systems that actually allow everyone in America to really live a higher quality of life, as well as have good health and well-being. So I think we can see what types of policies can make a difference. We've seen some of that. Now we just need to leverage them and make them more permanent so that we can actually really improve life at baseline in the United States.
Yeah, I hear that a lot, like what you're talking about, Dr. Marita, about wanting to keep policies that are helping people in place. And it's really hard to do, right? Because it comes down to money and politics, like making sure these decisions last. I mean, what kind of conversations are happening to actually keep some of these policies in place for years to come, so that when you think about, lessons learned now and applying them to the future and to other crises, how that money doesn't go away so that people don't fall right back into perhaps poverty.
Right. So I think the foundation supports a lot of work actually to build the evidence base for the positive impact that these policies have actually had. And so we can see that when we look at for example, expansion of the child tax credit or making that permanent, what happened during the pandemic was the expansion of child tax credit allowed individuals to get more money up front, and also to get it fully refundable as well. So there were definite advantages that happened because of the pandemic, but it was just for a short period of time. That expansion really lifted millions of families out of poverty. We documented that. And so that we can have that kind of evidence to say to policymakers, look at the difference this can actually make. No one in America, we should not have as many children as we have living in poverty right now. And through the child tax credit, we can lift these children out of poverty. And so the foundation's really focused on really evaluating what the impact of some of these provisions were so that we can make the case for policymakers to sustain these moving forward. So that's an example of kind of work that we're doing. The other thing the foundation is supporting is some work as it relates to looking at the impact of some of the negative impacts of some of the public health measures. So we know that social distancing, mask wearing, isolation, and quarantine were all really essential for prevention of disease spread, but there are also negative impacts, and we see that playing out from a mental health perspective. The isolation that people have felt, the lack of connectedness within communities because of these kinds of measures. And so we were doing a study to look at those negative consequences to see how that impacts social well-being. We're also supporting work to look at what is it taken in terms of community design to really improve connectedness moving forward. So granted, these kinds of things really had a negative impact, but what are the things we need to have in place to really improve the connection within communities? And a lot of it has to do with design. So we've developed some frameworks that actually comment about parks and green space, how that improves social connectedness and well-being. Sidewalks, we take them for granted in Chicago, but the sidewalks are not something that are really accessible in many, many communities, and it really does limit connectedness. So public transportation makes a difference in terms of connectedness and social well-being. So, there's what the foundation, among the many things that we do look at evaluating the impact of these kinds of social policies and public policies to make the evidence base clear to decision makers. But then we also do other research to look forward in terms of what is the future, what could the future look like if we design in different ways. And to me, that gives me great hope that if we take the lessons that we learned through this pandemic, many of which have been negative, but then also identify the things that have been positive, and then clarify what the value is, that hopefully we can really build a better future for our country by implementing some of these critical provisions that can really make a big difference.
Okay. One more question from me, and then we're going to get to some questions from the audience. I'm wondering, was there a decision that could have been done differently or something that didn't work, right? We're talking about a lot of lessons learned. We're talking about a lot of how important leadership was, but I'm wondering, is there something that just didn't work? Dr. Walker, you want to take that one first?
Yeah, sure. That's a great question. If I had to reflect during the time, I think when I think about the pandemic, I think about what's the message that we're sending to the world? What are our priorities? And I think priorities in a silo without any type of verbiage or bias around it, what we saw was that bars were open. Schools were the last to become open. It was very difficult to harness resources to invest around making sure the future of America is well equipped to learn again and avoid some of the mental health risks that Dr. Morita was mentioning around social isolation and inability to converse with their community, their friends, and have a traditional experience. I think what we probably could have done differently as a city, state, as well as nation was being able to communicate what our true values were and harness appropriate stakeholders around them. I think that was one of the challenges, because for the life of me, I was like, we got bars open, we got restaurants open. I was like, but schools we can't get people aligned with for multiple reasons. One around whether we're able to equip schools with the appropriate materials and equipment to be able to deliver education safely. And then also just around a misalignment around where we were at with the data and where places were high risk for transmission. So when I reflect back, I think, especially from an equity standpoint, because it was Black and brown communities that really bear the brunt of closing of schools, who relied on schools for lunch, who relied on schools as another place to feel safe. And what we ended up doing was kind of dragging our feet a little bit in order to make sure that schools were well equipped to deliver education, a quality education that was needed.
Okay, thanks. Grace, do you want to tackle that one too? I'm interested in your response to that.
Yeah, and maybe, I don't know if it didn't work, or maybe I think we severely underestimated the power of the vaccine hesitancy that was present throughout the state of Illinois. And so as I think about how much time and effort that we put into, our 24/7 facilities, so we run 7 psychiatric hospitals and we have 7 state-operated developmental centers, and all of those amazing employees went to work every day over the past 3 years without skipping a beat. And so when the vaccine was being deployed, it was a celebratory moment, but then it turned very quickly into a moment of great challenge, as we, needed to exert significant amounts of effort, incentives to really figuring out how we can ensure that the people who work for us felt comfortable and would be willing to take the vaccine, even after we figured out operationally how we could make it available, which we did in very quick order. And so I would say that was a surprise to us. And so we had to quickly, I think, figure out how we could, encourage, persuade, compel our employees as quickly as possible to take advantage of the vaccine for their own health and welfare, but of course of the welfare of our patients and residents as well. And then also needed to reach out to the guardians of people that we served, as well as the residents and patients themselves. And that those discussions, and I would say just that tension exists still. It unfortunately, I think that, pro or anti-vaccine took a lot of time and attention and energy away from things that, we really needed to devote our time to. And I'm not saying that it's not a consequential debate, but I would say that, it would have been helpful for me to really wrap my head around earlier, to know how much time and energy and resources were going to be expended to really persuade people who were eligible at the very, very beginning of vaccine rollout to take it. So that underestimation was pretty significant, I would say.
Okay, thank you. And let's get to some questions from the audience. We've got a question that says, what are some current policies or programs that you all believe offer promise for addressing structural inequities? Dr. Rita, you want to start with that?
Yeah, I mean, I can't help but think about Medicaid when I think about what happened because of the public health emergency. It allows for states to maintain their enrollment within the Medicaid system. So typically what happens, every year Medicaid enrollees have to re-enroll and go through processes. And if they don't re-enroll, they get dropped from the system. Because of the public health emergency, what happened is it said, the federal government said, you can just retain people who are on Medicaid, don't drop them from enrollment if they don't re-up through the usual systems, just retain them. And because of that, millions of people stayed covered throughout the pandemic. And that is really critical. And I think what there was with that change was an acknowledgement that the processes for re-enrollment are really cumbersome. They vary from state to state. People have to jump through all kinds of hoops to re-enroll. And so there's inappropriate loss of coverage all the time. But because of the pandemic, these people that were enrolled in Medicaid were allowed to stay enrolled and retain their coverage, which was just so necessary. What we're worried about right now is that's tied to the public health emergency. So when the public health emergency goes away, that protection goes away and people will be dropped. And that's really concerning because that will mean millions of people no longer have the healthcare services they actually need. So it's healthcare coverage in general that is the issue. The public health emergency also allows people in the marketplace to have enhanced subsidies so that more people are able to afford staying in the marketplace. And that goes away with the public health emergency. So these are things that states need to be working on now. The federal government needs to be thinking about before. We have 90 days now until the public health emergency is supposed to end. And it might be re-upped, but in that 90 days, states and the federal government really need to be thinking about how it is that we prevent millions of people from losing healthcare coverage, because that's an example of a structural barrier to people being able to retain the healthcare services they actually need. And it disproportionately affects people of color and low-income people. And so it's a prime example of a structural barrier that has significant structural racism implications as well.
You know, I'm kind of staying on that beat. Grace, are you able to talk about, because one of the things I'm wondering about when you're talking about Dr. Rita is, how is the state going to be able to find and reach all the people who were able to get on Medicaid during the pandemic? Because I think of all the people who have lost their jobs or quit their jobs and are living in different places. And one of the key things about making sure you're still eligible for Medicaid is to turn in a bunch of paperwork, right? But the state needs your address, which sounds so basic, but it's a big, important thing. So I'm wondering, can you talk a little bit about how the state is actually going to find people so that those who are still eligible don't lose their health insurance?
Absolutely. And so I want to second Dr. Morita's motion on the importance of erring on the side of allowing people to retain medical coverage. And I think fraud is a completely different issue. We're talking about ensuring people have medical coverage. And I would add that we should also err on the side of ensuring that hungry families and individuals have access to nutritious meals and food on a daily basis. Our SNAP program, which has enabled us to not only provide some of the flexibilities in terms of enrollment, but then also increased amounts of, monthly allotments for food, for food on their table. And I think that is a kind of an ideological shift, but it's definitely needs to undergird policy decisions. And so, Kristen, we've had discussions before on kind of the deep challenges the state had previously to actually efficiently and in a timely way process Medicaid application. This administration, I'm glad to say, has gotten to a point where we have our timely processing Medicaid applications. During the past several years, we've been able to actually take advantage of the technology that we have to ensure that can be sustained. We have state processing centers. We have a more efficient system for processing applications. And so the bones of government is stronger to enable us to make sure that we're continuing to do that. I think the piece that you talked about in terms of making sure that, the bones of the process are sound. The other piece of it, to your point, Kristen, is how do we make sure that we're reaching out to people? to make sure that they're aware of their responsibilities in order to be able to continue to be on Medicaid and other public benefits. And I think it goes back to what I was talking about earlier, that we need to have explicit, focused communication and public education efforts in order to do that. I mean, we do have, obviously, the information that we have for these individuals already, but if they've moved or changed addresses, we're going to have very specific, tailored efforts to reach them. And because we have, I would say, better bones and more staff actually who are processing these cases, we can do individual outreach. And so leadership matters. We are going to ensure that we leave no stone unturned, and we're not going to let the paperwork allow people to fall out. And so I think it's going to be kind of relentless macro efforts, but then also micro efforts that are going to be tailored to reaching out to the people who are unresponsive. And so the Department of Human Services was working very closely with our Medicaid agency, Healthcare and Family Services, right now, and as well as our community partners, our web of community partners who in some instances may have even a better platform to communicate with these individuals.
Okay, thank you so much. And then we have time for just one more quick question. It says, to comprehensively address health needs, we need to include a wide range of community organizations. What aspects of communities should be engaged that are typically not involved or consulted? Dr. Walker, can you take this one? I think you touched on this a little bit earlier.
Sure. I think part of it is just having a regular means of communication so that state or different institutions can just have a better understanding of the lived experiences of those communities. I think oftentimes decisions could be made in silos and you can make assumptions that could go the wrong way. I also think community-based organizations should be able to be part of the ecosystem of healthcare delivery. I think one of the biggest initiatives that we should be trying to talk further about is how do we remain accountable for healthcare disparities and tie that into healthcare delivery, whether it be compensation or how physicians interact with patients and how you evaluate equity on a metric. But I think the community-based organizations can play a critical role by having continued relationships with different institutions, as well as especially healthcare. And one of the main goals that we were trying to put forth was how do you build an infrastructure that can be ready for any epidemic, whether it be gun violence, opioids. What are the things that we're doing now that work, and how can we disseminate information and elicit information that can better prepare us to be able to protect and reduce those disparities, as well as reduce the burden of different epidemics that are affecting our state and our nation.
Okay. Well, thank you so much to our panel, Dr. Walker, Dr. Morita, Grace. We're going to take a short 15-minute break, but I just wanted to thank everyone so much for your time and have a great day.
Thank you.
Mm-hmm.
Welcome back from our break. Hopefully you've had a chance to grab a coffee or refill your water bottle. Now we turn to our second panel of the morning, the mandate for equity. How do we ensure an inclusive post-pandemic recovery as we rebuild our economy? Our moderator is Lisa Lee, Executive Director of the National Public Housing Museum, a cultural activist, and an associate professor at the UIC School of Art and Art History. Lisa is working with public housing residents to open a museum in the last remaining building of the historic Jane Addams homes, with the mission to preserve, interpret, and propel housing as a human right. She was previously the director of the Jane Addams Hull House Museum, where she oversaw a renovation of one of our nation's most important historic sites, installed a new permanent exhibition, and reinvigorated public programming. Lisa serves on Mayor Lightfoot's Commission for Monuments, Memorials, and Historical Reckoning, and serves on the boards of the Illinois State Museum, 3 Arts, and the Field Foundation. Now I'll turn it over to Lisa to introduce the panel topic, our great panelists, and get the conversation started.
Good morning, everybody.
Good morning.
Good morning. Yeah, thanks to everyone out there in the Zoomosphere. We're so grateful that you are here with us. We know you can be anywhere in the world. So as a reminder, I just want to also invite you to please drop your questions into the chat below, and we will make sure we get to them after our conversation. My name is Lisa Lee, and I'm so thrilled to be here with Gloria Castillo, the Associate Vice President of the Chicago Community Trust and Director of We Rise Together for an Equitable and Just Recovery, with Jan Foreman, the Executive Director and President and CEO of the Emerald South Economic Development Collaborative, and of course, Samir Mayakar, the Deputy Mayor of Economic and Neighborhood Development of the City of Chicago. But as a way for the audience to get to know you, I want to ask you each to share with us how you understand your work. For example, I primarily understand my work to be as an arts and cultural organizer. And as a cultural worker, I rely on Toni Cade Bambara's job description, where she said, the job of the cultural worker is to make the revolution irresistible. And that's what I do. I try to create collective joy and ensure communities generate cultural capital in order to create a world where everyone not only has the right to access beauty, but everyone has the right to determine what is beautiful for themselves and their communities. How do you understand what your work is in this world today? Gian, can we start with you?
Sure. So my work at Emerald South is concentrating on the neighborhoods on the south side, close to the lake. With the Obama Center coming to the community, we thought about how do we make sure that the communities benefit, not just that we have an incredible new museum coming to the community. So I think about my work, it's in our mission. We think about our shared pride, our shared power, to make sure that we can all benefit individually and collectively to bring resources to the community.
Great, thanks. What about you, Gloria?
It's interesting. I've spent the last 20 years as an advocate for social and economic justice. And, you know, I think about that, and I think actually it's a little bit narrow, because it is, in the same way, I'm a worker at this. It is both my passion and, you know, what I do professionally. And I do it in kind of a narrow space. I've really focused on the business community and thinking about how do we help the business community really understand that their practices, their policies affect the way that we live on a daily basis and affect the kind of equitable distribution of opportunities and ability to achieve and live a quality life. And so, you know, I kind of get up every day thinking of my three Ps, which is purpose, pride, and people. You know, I need to know that what I'm working on is going to make a difference and that I do it with integrity. I can wake up and I know I'm proud of the work I do. And if it, you know, that's critically important in the way that I approach the work. and that I make sure not to get so distant from the people that I advocate for that I don't really understand what their needs and aspirations are. So to really, focus on remaining grounded. And so that's the way that I've approached my work over the last 20 years and hopefully for many more to come.
Yes, hopefully so. Samir, what about you? We know you're also a new dad, and so that probably is one of the hats. Congratulations, by the way. But, what does a deputy mayor do, or how do you understand your work?
Well, so what I'd say is for those of us in city government, what we wake up every morning and think about every night is how to enhance the quality of life for our 2.75 million residents. And so with my hat on as the mayor's lead for economic development, I really think every day and every night about inclusive economic growth and really in two different dimensions. The first is how do we recover from the pandemic? And the pandemic hit different parts of the city in different ways. And how do we make sure we drive an inclusive recovery? It's one of the reasons why we published the first comprehensive economic plan as to how we get out of COVID of any city in the country. And then the second component, I think, of the role really is focusing on Mayor Lightfoot's core pledge to extend the focus of the city in terms of economic development to the west side, to the south side. She always talks about we need to focus south to Roosevelt and west to Ashland. And so a lot of you know about our Invest Southwest program. And my team spends a lot of time making sure that we're driving economic growth in an inclusive way in those neighborhoods as well. So those are those two key areas of focus: recovery and really pushing the growth on the south side.
Great. We're going to talk a lot about those issues that you brought up. But first, because this panel is really about being post-pandemic, and I think many of us maybe don't even feel that we are post anything, as the ravages of the pandemic continue to be felt in many communities. But I do want to ask you, as a public historian, I really believe that we have to go upstream in order to solve problems. And for a historian, upstream means going back in time, asking what have we not yet learned from the past in order to create a more collective future. And we suffer from a terrible historical amnesia in our society. And even now, as mask mandates fall, I feel like we're already forgetting the lessons of yesterday, today. For each of you, what is a lesson from the pandemic that you hold close to your heart as you're doing your work? Can I start maybe with Gloria?
Sure. I think in this context, for me, I'm not a public health worker, and I focused on business. And I had a great opportunity in 2010, as we were coming out of the Great Recession, to work with the Federal Reserve Bank of Chicago to conduct some research and looked at the prior 6 recessions. And what I saw in those prior 6 recessions was that the recovery was always unequal. You saw an acceleration of recovery for the white community, but for the Black community and Latinx community, we were consistently left behind. So when I took that long historical view, it told me that if we just allowed this recession to roll out towards recovery, as much as this recovery is not like any other, because the pandemic continues to evolve, right? We don't know that we're not going to get another variant beyond the one that we're beginning to see today. And that continues to affect the economy. But what we do know is that unless we are really intentional, we're just going to see the gap widen. It's going to continue to widen for the Black community and for the Latinx community. And we see that already just in how the pandemic rolled out, right? We saw that the Black community and the Latinx community were hardest hit by job loss, by mental health stress related to food insecurity, housing insecurity. So for me, having the opportunity to kind of take an all hands on deck approach was the way that I could think about holding change in a recovery like close to me, really knowing that we were going to engage the philanthropic community, the business community, the nonprofit community, city government, county government, and people from the community, and thinking through how do we make this a more equitable recovery. That's what I hold dear just from looking at the history of economic crises.
Samir, what about you?
Well, as you know, you can imagine, we've learned a lot of lessons over the course of the pandemic, especially being in government. I think the pandemic really exposed how, we really do need the government and the private sector and the philanthropic and nonprofit sector to work very closely together. For me, one of the core lessons, and I think maybe it's the inner entrepreneur in me, and that's what I did before coming to government, is that decision-making velocity matters. So when you think about the early parts of the pandemic and how fast, things shut down, how fast we were to adopt masks, how fast we were to get the vaccines, rolled out. Oftentimes, I think in government, you can always try and have the perfect be the enemy of the good. I think what we did a good job of and was a key learning as to how we can apply this moving forward is that decision-making velocity matters. You can get the streets shut down for open transit in new ways for people. You can get parking lots and sidewalks activated for restaurants. You can shut down streets you never thought possible all throughout the city for activation so that people could be outside. And I think if we take those lessons on decision-making velocity and apply them to the needs of the city moving forward in this pandemic recovery phase, I think it will be a very good lesson learned, not only by the government, but by all of us to challenge ourselves as to how can we think in a different way. One of the sayings I have is, we don't want 2019 thinking. And so we really need to adapt to the new reality in front of us. And that decision-making velocity is really what matters.
Yeah, I love that there was this incredible opportunity to not only demand the impossible, but to imagine what seemed impossible. Gian, what is a lesson that you have learned from the pandemic?
Yeah, I'm really proud of how community came together to support each other, right? And we see that in really difficult times, we have the ability to come together. I don't know that we understood that there was food insecurity, but not the levels that we were actually able to see. So to see neighbors come out to donate food, of course, organizations like the Food Depository come together, diapers, things that are everyday things to a lot of us, we were able to understand the dire importance of it. So just because we're not in the same kind of crisis stage of pandemic, those needs still exist. So how do we come together? And when we come together, we realize that we have enough, right? And so I think that one of the big lessons is Chicago really came together and became one city during that period of time. That's the mentality. It's critical that we keep up, right? Whether we're talking about pandemic or economic recovery or education, that we are one city, we are one people, and that the problems of one, you can't separate from the problems of another. And so I think for me, really seeing that feeling of Ubuntu, right? Where my problems are your problems, right? My wins are your wins. That is really kind of how we have to be able to succeed as a people.
Yeah, definitely. That sense of the common good and the commonwealth that needs to be shared with everyone, I think resonated throughout the city. Let me ask you a question. Chicagoans historically have had a lot of pride in our city, and also we sort of have a second city syndrome. I wonder, do you feel like Chicago is exceptional in both its troubles and its solutions, or are there things that we can and should be learning from what other cities have done and are doing that could benefit us? I want to maybe start with Samir on this because you're working, directly in sort of city government. How is Chicago, unique, and how is Chicago not unique?
Well, what I would say is both of these things can be true. So first of all, we are unique in that we've had a pretty significant recovery from the pandemic. So when you compare us to our big city peers, our unemployment rate throughout most of the pandemic, and is still true today, is lower than our big city peers of New York, LA, Houston. When you look at how the small business sector has recovered, you look at business license activity, construction activity, apartment occupancy rates, we are leading in many of the economic recovery indicators. I think because of the underlying diversity of the Chicago economy, which is a key strength, but also the purposeful collaboration we've had between public, private, nonprofit sector to really work together on recovery. So the economic plan has worked, and that's something the mayor talked a lot about yesterday in her speech to the City Club. So I think we are a standout in many ways. Now, we also have a standout issue in terms of some of the disparities between our neighborhoods, and that recovery has not been uniformly felt throughout all of the city. That really, and Gloria and Guion know this well, the challenges that we faced in our communities pre-COVID were exacerbated by COVID and are even more profound today. And it's one of the reasons why this focus on the South and West Side is so important. It's only really doubled down our conviction to continue to help shape investment flows into those communities. To your question about what have we learned from other cities, we constantly benchmark ourselves from other cities globally, and we get a lot of outreach from other cities around the world. And so I'm proud to be in a cohort of my peers amongst big cities. They were asking us, how did you shut down so many streets to activate restaurants? How did you recover economically so quickly? If you look at some of the other recovery plans, New York just published one last month. This was something we were the first in the nation to do. So people are looking to us as an example. And similarly, we were looking to other cities in terms of creative ideas on outdoor activations, creative ideas on vaccine campaigns. So I think that cross-sharing among cities is something that we take very seriously. But we are really second to none in many aspects of our recovery. And I think that is, other cities have taken note, and certainly the mayor is proud of that.
Yeah, Guion, you stay representing South Side, so I know that you think that Chicago is unique. Can you talk a little bit about how you're understanding, this Chicago community and its needs as being unique to what has happened in the past, histories of disinvestment perhaps, and what is needed now?
Sure. So not only, I think Chicago has some unique qualities, but I think we share some qualities, but we also are unique within neighborhoods, within communities, right? You have groups like Jamal Cole, who takes people from different parts of the city to other parts of the city. I've met people on the southwest side of the city, kids, or on the west side who've never seen the lake before, right? And so as I believe we should be using this time to kind of rethink everything. Is our education system teaching our kids what we really need to be learning right now, right? At a point when we're trying to figure out the wealth gap, people are creating new forms of currency, right? So we're still trying to figure out the old forms of currency and new forms of currency. So how at the same time, while we're planning this equitable recovery, do we also look forward and think about what the kind of potential is, right? So for example, we're working on a program where we're looking at the vacant land. The area where I work is 200 acres of vacant land. And so we looked at a program that was done in Philadelphia to clean and green this vacant land. And it found that when you did this, violent crime was reduced by 27%. Mental health was improved by 69%. Job creation. So we work closely with the city and some of their programs, and ICEJA, some of the marijuana dollars to fund this, and some philanthropy as well as private companies to fund this. And so we're looking to say, how do we think about these things in communities that we normally think of as deficits, as liabilities? How do we think about these things as assets, using the city as our partner, using philanthropy, looking at other cities as examples, looking at other communities as examples? So for example, if you think about, we're dealing with commercial corridor vacancies. Michigan Avenue had a lot to learn from us in the South Side because we have been dealing with that for a while, right? So it's not a one-way street. There's something that we can learn from each other. And I think that this is some of the opportunities that we have right now as we start to think about an equitable recovery.
Yeah, I like that so much. As my work at the National Public Housing Museum, we're always insisting that the rest of the world has so much to learn from public housing communities, and to sort of see this history as a cultural asset for all of us, and to be asset based instead of always thinking about what the problems are. That sometimes the people with the so-called problems are the people with the solutions. Gloria, you're sort of leading We Rise Together, an unprecedented coalition of sort of private, public, business sectors. Is how is Chicago unique or not unique in its effort to address the post-pandemic recovery?
Well, I think it's really interesting that We Rise was born out of the Chicago COVID Response Fund, right? And I think what was really unique, and maybe not unique, but certainly forward-leaning, was the fact that you had the Chicago Community Trust and United Way of Metropolitan Chicago come together very rapidly and raised over $35 million to distribute in response funds. But what the learning out of that, I guess where I would say we had a deep learning, was initially those funds, in order to get them out the door, depended on very large organizations that had big infrastructure and could move quickly to get the dollars out. Chicago Food Depository, for example. But they worked with more localized nonprofits who understood who needed the support on the ground. And as the grant making continued, it actually morphed into a really strong network of smaller nonprofits closer to the community who understood what the community needed, how they needed it, whether that was rent support, whether it was food, whether it was support in other ways. They were able to mobilize very rapidly. And as a result of that, philanthropy is changing in Chicago. It is thinking more at the community level. And I think that is something that we can be very proud of in Chicago, is that we didn't do the same thing that we would have done 10 years ago. Instead, we moved quickly and we evolved quickly and grounded the work more directly in community. And that was incredibly beneficial.
Sort of stay in this issue for a little bit. We often hear about the resilience of certain communities. But of course, certain communities are forced to be more resilient because of histories of exclusion, white supremacy, the ravages of racial capitalism. In each of your work, how are you directing resources and really addressing these unjust histories in order for a more just recovery from the pandemic? Can I actually start with you, Gian?
Ooh. That's a tough one. I definitely think it's important to recognize what has happened in the past, right? This is how we ended up here. And I think that looking at initiatives like Invest Southwest is saying we are going to recognize this, right? And we are going to repair some of the injustices that have been done in the past. Reparations is a bad word to a lot of people, but it means to repair. So if we're thinking about how, as a city, we can improve. So if you think about it, violent crime was not really an issue to most of the city until it started happening in their neighborhood. And then crime is out of control. Well, in my neighborhoods, we always thought crime was out of control. It wasn't a function of, it's a little bit, what is an acceptable number of shootings? It's always out of control. And so it's important that while we recognize these things and we start to put some tools in place, like We Rise Together, like Invest Southwest, that we also at the same time, while we're creating these financial opportunities, that we do look forward to kind of think about what are some of the opportunities to think forward a little bit, right? To be able to say, what are the opportunities that are coming next? So if you think about some of the initiatives taking place at city colleges, Dawson Tech or Kennedy King or Daly College, there are opportunities for our young people to go to school for free. This is something, but now it's our job in the community to make sure that our young people understand why it's important, right? What do we want our communities to look like? So, I'm just using that one as an example. There are a ton of opportunities that we can think about. For me, obviously, one of the closer ones that we have at heart is the Obama Center that's coming. What does that mean? Is it just a nice building, a nice place you can go, for a family reunion, a beautiful park? No, this is a place where you can go to understand, right, some of the challenges that as a people we've been facing, as communities we've been facing, and coming up with solutions how to overcome those things in a sustainable way. You talk about resiliency. I think our communities, the communities that have been underinvested in, this is the definition of resiliency, right? At the same time, we have to think about how do you stop that population loss, right? How do you make it that this is a place where you should stay, where you do want to raise the next generations of your family? How do you do that? And so I think that this is a solution that we all have to come up with together, not just in Fulton Market. And how do we not just grow Fulton Market, right? But how do we make sure that we are growing the populations of South Shore and Inglewood, those places where we talk about where there is the vacant land? How do you make this an attractive place for people to stay and live and work and play?
Yeah. Earlier, we were also just talking about how all of these issues are so related, right? Like loss of Black people in Chicago and how it's related to the lack of affordable housing, and also how the lack of funding, also is about priorities and how much we're spending on policing versus schools versus housing versus public health issues. I think that is so important, and thanks for calling that out. Gloria, is there a way that you feel like the trust can and should and is really focusing on Black and Brown communities on sort of the South Side and the West Side? And, how are you taking history into account for, moving forward?
Well, I think at the large level, the Chicago Community Trust's mission right now, our vision is to close the racial and ethnic wealth gap. And there's a really good reason for that, because number one, it addresses the history, but it also addresses our ability to move forward as a community. We know that if we strengthen the Black community, if we strengthen the Latinx community, we expand the opportunities, we close that racial and ethnic wealth gap, we will actually have a stronger region. It makes it better for everyone. And so having that as an umbrella to kind of use that as our North Star, then we rise as thinking about how do we actually accelerate that coming out of the pandemic. If we try to bend the curve of the recovery towards the end of the recovery, 6 years into the recovery, 8 years into the recovery, we've lost our opportunity. We need to act with urgency and very deliberately right now. And the only way to do that successfully is to actually listen to what the community tells us. What are their aspirations? How do they see their neighborhood? What do they need? And then by listening and believing and investing in what the community tells us they need, we can actually start to build stronger communities. And that's why we've taken this approach of when we make our grant investments, we're doing that based on projects that communities have told us they want. And so whether it is a brick and mortar project in the community, whether it is a workforce development program at a particular nonprofit in the community, whether we are thinking about how do we strengthen the Black and Latinx businesses that are in the community so that they can sustain and serve their communities, that's really how we've changed our grant making approach, is really centering on what we can do that addresses the aspirations of each individual community in the way the community sees itself. And so I think, applying that lens to the historical disinvestment is how we can start to close that gap.
Yeah. I just want to also put a reminder out to all of you out there in the Zoomosphere. Please do put your questions into the chat box and we'll make sure that we get to them. Samir, tell us, how is the city focusing on historically disinvested communities in order for us to ensure more equitable recovery?
Well, as you can imagine, this is a huge priority for Mayor Lightfoot. So since day one, and I had the honor of co-chairing her transition, equity was a key central pillar. And that was one of the reasons why she created a chief equity officer and an office to focus on this and really go and train all of the city on this very important topic. And I think you're starting to see the results of that. But it is a process. Our chief equity officer says frequently that we are building the muscle of this capability and this focus of equity within city government. But when we first came into office in 2019, there was one statistic that I think encapsulates this history that you mentioned. And that is that there is a almost 500% gap in investment flows per household between the north side and largely white neighborhoods and the south and the west side and largely black and brown neighborhoods. So there was a study that came out that said almost $20,000 of private investment was mobilized per household over a 5-year period in kind of more affluent parts of the city. And the same amount of private investment in black and brown neighborhoods and the south and the west side, largely because of how segregated the city can be, that was less than $5,000. So that's a 4 to 5x gap in private investment. So that was the root reason why we created Invest Southwest, was to channel billions of dollars of government investment in a way that would stimulate a match and a multiplier from the private sector in businesses and from folks like Gloria, who we've coordinated really well, from philanthropy. And so in the first 2 years of Invest Southwest, we've mobilized $1.4 billion. Half of that comes from us in the city, and half of that comes from the private sector and philanthropy. And some examples as to how there is a new economic model being developed in Chicago. Discover Financial, they built a 1,000-person job center in Chatham on the south side, employing people within a few mile radius with these great jobs, all in Invest Southwest communities. Blue Cross Blue Shield did the same thing in Morgan Park. Yesterday, the mayor announced Harvest Foods is moving into a 10-plus acre vacant lot on the 47th Street Invest Southwest corridor, bringing 250 jobs, $60 million of investment. And we actually have RFP'd out over 10 huge city-owned lots in the Invest Southwest corridors and picked largely black and brown development teams to the tune of them mobilizing $300 million in 10 mixed-use developments. So when you quantify in one neighborhood, as an example, in North Lawndale, if we add up all of the Invest Southwest pipeline of what's to come, it will translate into over $15,000 of investment per household. That closes the gap. So that's really what the focus of Invest Southwest is, and how we're bending city government towards that trajectory that is fundamentally more equitable. The work is not done, but I'm really proud of the progress we've made, and the momentum is just going to continue building as the years ensue.
Yeah.
At least if I could just add on to that one.
Sure.
So one thing that I think is critical, I think we see the city making an effort and some corporate as well. I think we see philanthropy. I think we see community. I think it's time for us to make sure that corporate really steps up in a different kind of way, right? They have data. They know who their clients are. They know how much money is being spent in these communities. Nike or Pepsi, or in these communities, these are their clients, right? And it truly is a matter of life and death in these communities, right? And so I think that we as consumers need to put some additional pressure, using our friends in philanthropy, using our friends at the city, right? Using our dollars to ask them. We've been supporting corporate for a long time. It's time that we ask corporate to support us.
And let me just build on what Gian just said, because I think it's so important. Not only do they have a responsibility to the community in which they have made their investments and that they've received dollars from, but there's talent there. There's great talent there. And what Discover will tell you is that call center is now one of the highest performing, if not the highest performing center in the Discover system. So it is not as if that investment isn't paying out for them. That investment is paying out very well because they have a very stable workforce, a very engaged workforce, a very high performing workforce. And that's an example that can be replicated for other businesses who choose to take advantage of and build on the assets of the community.
And put quite simply, investing in the South and the West sides in our Black and brown communities is good for business. That is what we are trying to say here.
Yeah. No, and I also think more than a call out, a kind of call in for corporations too, right? Because many of these corporations have historically been the cause of a lot of problems. I know in housing, for example, looking at the history of redlining and sort of the injustice around sort of mortgages to Black and brown people, like Chase and other banks, they are responsible for some of these inequities, and the people who are there now have just a historic opportunity to be accountable to this history. And if not calling it a reparation, perhaps a remediation, the human thing to do. There's a lot of different ways of thinking about it. But let me ask you a question, because as a member of the Chicago Torture Justice Memorials, and who worked to pass a sort of historic landmark reparations case in the city of Chicago, I want to just directly sort of say that in the sort of Lightfoot administration, there has been like an increase in our policing budget. It now is, $1.9 billion. We spend maybe over $5 million a day on policing. And I know, Gian, you are a member of the police board. How there are a lot of young activists also at UIC who are abolitionists, who are, calling on us to defund the police, readjust our priorities. How is sort of the spending on policing and other kinds of sort of surveillance tactics in our city, maybe taking away from the kinds of investment we were making? Or how are you thinking about policing in this conversation about economic equity? Can we start with you, Gian?
Yeah, we can start with me. So, my role in the police board, a lot of times it is kind of looking at information objectively and trying to see both sides. And so, in some communities, they feel that they want more police, and in other communities, they feel like they want less police, right? And so I think that what we're really saying is how do we balance this huge budget to serve the needs of the community, right? Perhaps if there was more investment in other areas, you wouldn't need as large of a police budget. So the defund, this is just my personal opinion, the defund terminology itself, it probably was bad terminology, right? Just simply because it set up a position where somebody had to be against somebody else, right? And so what we're saying is how do you set up a situation using this pot of money to serve everyone in a way that's going to be helpful? And I think that this is some of the conversations that have been taking place right now. And I think that I don't know that there's a simple answer. I was able to participate in this participatory budget making process, and it was very interesting, where you had to take a pot of dollars and say, where would you put these things? And based on your perspective, everyone is going to have a different perspective, right? And so the way I kind of boil it down for me personally into three things, and that's peace, health, and prosperity. Right. One, if you're missing one of the three, you kind of have none of the three. And that really, if we think about that as a whole, for the city of Chicago, regardless of what neighborhood you're in, that really is kind of what it boils down to. And so how do we think about the dollars that we have? Not just police department, right? All around. How do we think about corporate dollars that they invest? How do we think about philanthropic dollars that are invested? How do we, the community, think about the money that we spend to achieve that peace, health, and prosperity? So I know I'm not answering your question directly. I think that this is going to be something that's going to be an ongoing conversation, and especially difficult to have when we're at 25-year highs in terms of violent crime, to be able to say shift those dollars around. But how do we use those dollars? How can we use the police department to be a real asset in our community?
And let me build off of what Gian just spoke of, because I think this is a fundamental question that great cities in America are facing today. And too often I think it's presented as a zero-sum game. And I do just want to make sure people know that the city of Chicago and the budget that the mayor has really advocated for and that passed last year, it invests in safety, but it also invests in other areas beyond the police. And so what are those examples? We funded a co-responder model in a few neighborhoods where when there's a mental health call that you don't just have an armed police officer responding, that there's a co-responder model with trained mental health professional. That is really working, and something that, depending on the results of this pilot, could be expanded. The Chicago Recovery Plan, thanks to the federal dollars that we've received, we're going to be making historic investments, over $1.3 billion in our communities on mental health, on economic development, on fundamental city services to help our residents. So, I think there doesn't have to be this debate as to, just focusing on one budget line item. Right now, the budget pie is growing because of federal resources in this unique time. And we need to really respect the voices of our communities, of which there's not a universal consensus in terms of how to tackle this issue. And if you look at cities like New York, if you look at other big cities, they're going through this as well. So there's not an easy answer. And I think that the defund sort of question is probably oversimplified and needs to focus on the holistic needs of a community. And that's what our city budget is really trying to do.
And I would just add that as we gather qualitative data from our communities where we're making our investments, for example, we hosted 7 community conversations, community perspectives on COVID-19. And what we heard from people was that they were feeling stress from, emotional and kind of mental challenges that COVID brought on. But they also expressed that they wanted to feel safe in their neighborhoods. And so that comes in a number of different ways. That's obviously balanced, the kind of balance that Gian referred to and that Samira referred to. It is both making people feel safe in their communities from crime and also safe in their interactions with the police. And that's what people were really telling us. They wanted both. And the entrepreneurs who are opening up new businesses on the corridors where we know they need the most investment, and in order to transform those corridors, they want people to be able to come to their businesses, and they want people to be able to walk those sidewalks and feel safe. And so I think we have a real challenge in front of us, but it is a challenge of how do we deliver the services in a way that make people feel safe on their streets, but also safe in their interaction with the police. And that's got to be the ultimate goal.
One thing that I want, you've sort of mentioned some direct strategies. Sometimes we spend so much time on what we're against, we sort of don't focus on what we're for. And, whether it's community land trusts, community benefits agreements that we demand institutions and corporations sort of create with their communities, or right now, for example, just a shout out to the graduate students at UIC who are striking for more fair wages, so organized labor. What are some of the tools that you think that communities have at their in their toolbox in order to push for equitable development? And I'm also going to sort of let people know that we're going to be starting to ask questions real soon from you all. So does any of you three want to take that on, sort of tools that communities have used or can be using or should be using?
I can give you an example of kind of the new model for what I think can be large development to the question you're raising. So if you look at the case of the Bronzeville Lakefront development, this is the former Michael Reese site. It's, I think, over a $4 billion development, but it was really done with the community in mind and really with the community at the table. And so one of the things that Mayor Lightfoot did pretty early in her tenure was to make sure that if you're planning a large development that goes through all the city bodies, that there has to be a process for community input. And we created community advisory councils for these large developments, which had already existed at the Michael Reese site, to make sure that there's continuous input and continuous engagement. Because at the end of the day, I think both Gloria and Gian highlighted this, these developments have to really uplift the desires of the communities. And if they're not at the table, when you're designing those developments, then you're leaving something on the table. So the mayor understands that, and I think those forums have been very active. And so that's what I would say a call to action would be, get involved when you have these community developments coming to your neighborhood, and make sure that you're at the table, because the table is now open to you. And I think whether that's in an Invest Southwest project where we have community roundtables that are set for the first time, I think, in the city's history of its kind, or whether it's a large development like the Michael Reese development. I think we've seen this as well with the Obama Center. You get the stronger decisions when the community is at the table, and community benefits and those commitments, especially if you look at the Michael Reese development, they were a part of that development. And I think it's a great model for the future.
So since we got Samir on the call here, what if all these mega developments, 50, 75, 100 acres, what if the community actually owned that vacant land in that community, in Inglewood, if the community actually was the landowner, right? In Garfield Park, in Washington Park, if the community was that owner, and we understood the tools that Related or Sterling Bay or the Bronzeville Grit team put together to create these kinds of development. So the community could now not only benefit from this new development coming into the community, but financially benefit as well. The jobs, the ownership, the wealth creation from the ownership of the land, the wealth created from the development of the land, the ongoing jobs, the housing, that would be incredible to me. So Samir, let's work on that. Let's put one of those kind of mega developments together.
Well, it's a great point. And actually, within our recovery funding, we have funding allocated to focus on community wealth building pilots. I think what you're raising is could be a new model, and it's one that we really need to prove as to what it could look like, so that you can get financed to do this transformative work, but making sure that the community is benefiting from that wealth creation. We are with you on this. It's really going to come down to, how do we do that? How is that accomplished in a way where the needs of all the stakeholders can be met and you can get the project financed?
That's great. We have it on the record with Samir saying that. And I mean, maybe that goes to one of the questions from the audience is how do we make sure that Invest Southwest projects don't just accelerate gentrification in these neighborhoods, right? And I think something that Gyan brings up, which is sort of land ownership and community control, is perhaps one of those ways. Are there other tools that we can use to actually make sure that in our effort to invest in communities, we don't actually just accelerate gentrification?
Well, I'll give you the example of Woodlawn, where with the coming of the Obama Center, you've seen a lot of speculation on real estate. You've seen a lot of development interest and a lot of real concerns about displacement. And so the community there's a lot of people who want to see land values increase and property values increase because long-term owners can benefit from that. And there's also a lot of people who really don't, they don't want their rent to go up and they don't want to be displaced. So how do you accomplish development without displacement? In the case of Woodlawn, we passed a law that basically mandates that on city-owned land, of which there is a lot in many Invest Southwest communities, and this law pertained to Woodlawn, that there is a commitment to affordability on future development on those parcels. That's how you can accomplish development without displacement. We have funding to help long-term tenants. We have funding to help long-term property owners invest in their properties. And so there are mechanisms that can be applied surgically in the right way where you can enhance development without displacement. But I will say in many Invest Southwest communities, we have thousands of vacant lots. And so, I think the focus needs to be on enhancing the development and creating more units for people who want to live there. But the nuances of those neighborhoods are very different, I think, from other parts of the city where you're seeing much more gentrification, where you don't have land availability. And I think we need to, view each neighborhood's needs in the context of that neighborhood, because sometimes the word gentrification can kind of be thrown out there in a way that's not authentic to the exact needs of that community.
No. And I would add to that, Lisa. Yeah, I would add to that, when I think about communities, I think about the small businesses that are so important to community. And what we're looking at with a number of nonprofits is trying to think through how do we support the business owners who are currently in communities, support their ability to buy buildings so that they can locate their business in a building that they own, so that they can remain in the community and continue to serve the community. And right now, a lot of small business owners rent their space. And as communities then start to gentrify, they really are pushed out of the communities that they've helped to build. So we think it's really important to start thinking about how do we stabilize those small businesses in buildings that they own. And then that will really help to make sure that those who have helped to build the community can remain in the community and continue to serve the community. It's one small slice, but sometimes you have to look at the unique needs of different populations. In this case, small business owners are a really important part of rebuilding communities. They center those communities. They are part of the community. They contribute, in really meaningful ways. And so I think we really need to pay attention to that part of our population.
Yeah, and maybe also because, as somebody who is part of the museum world, not separating the idea of businesses from arts and cultural organizations that are so attentive to community needs and the development of cultural capital, which I think is, some of the greatest assets that the South and the West communities actually have. Somebody has a question about how can we integrate climate justice and sustainability into equity initiatives. I know, for example, Ms. Cheryl Johnson out in Altgeld has been, a leader in thinking about solar energy and how building and housing should be incorporating climate justice and also taking into account the histories of environmental injustice that have happened in some of these communities. Gloria, is climate justice part of the trust sort of on their radar, and how are you thinking about that?
Yeah, absolutely. And in fact, when we're thinking about our grant making at We Rise, we are looking at the entire project. I mean, Guion's project, for example, and I'll let him speak to it specifically, is looking at how to use solar energy and use it in training. But even as we're looking at our workforce grants, we're being really intentional about thinking about how do we help people be trained for the green jobs that will be coming as a result of the federal dollars coming in. We want to make sure that we have people who are ready to take those jobs, that they have the training, and that somehow the jobs that are going to be created in that green economy are not going to roll off elsewhere. So we've got to think about this holistically. We have to think about not only the brick and mortar aspect of it, but we have to think about the job training component of it, and be sure to invest early so that it becomes part of the initial projects. But every single one of the projects that we look at, we're looking to see how are they including environmentally friendly practices into the projects that we're funding.
Gian, did you want to jump in there about your work in environmental justice?
Yeah, I mean, I think it's critical. I think that it's not something for the future, it's something of now. But these are the jobs of the future. As we start to think about decarbonization of buildings, we start to think about our air quality. It also impacts our health, right? So again, going back to that peace, health, and prosperity, right? This thinking about our environment is critical. And so sometimes I think it boils down to the language that we use. In the communities that I'm working in, people who are first priorities are thinking about violence and jobs and things. But if I ask them, do you care about the environment? It's less of a priority. If I ask them if their basement floods, then the answer is yes, it does. And then I'm able to say, well, that's environment. And then I do care about it, right? So sometimes I think it's the language that we use. And so to tie that back to what are the job opportunities and that kind of thing is where we have an opportunity.
Great. So somebody has asked a question about something that we were talking about earlier around community college initiatives. They are deeply concerned about schools on the South and West side, many of them that were closed, during the Manuel administration. And the question is how are we focusing on the future of education in our city as a kind of basis for economic empowerment? And I think many of us know the importance of education. We're here at UIC, our city's great public university. And there's so much debt that is out there with students that will, forever hinder them in ability to achieve, sort of prosperity. What are each of you sort of doing, and how are you engaged in addressing educational disparities? Maybe we can start with Samir.
Yeah,
the
you know
city?
what I could say on the city college side. So I think we have to move away from this model where, you know, a 4-year degree is kind of the end all be all. I think what we've seen in the economy is there's so much opportunity, and we need employers to also be open to different pathways. So the city colleges and the mayor is really going to be pushing more towards this, is that pipeline between you know, CPS and city colleges, and increasing the vocational focus starting at a younger age in CPS. So you know, our youth get more exposure to different industries and really to fields that they might not be aware of. That's going to be an increased focus, while at the same time we engage employers, and many employers have stepped up to the call here to say, you know, it might be time to rethink, like, do you really need a 4-year degree for this particular role? And I think in the massive talent shortfall that they're experiencing today, the Great Resignation, you're starting to see employers move. And I think hopefully we'll see them move a little bit faster. But I think the key here is that, you know, the mayor always says you can't be what you can't see. And we need people at a younger age to be able to see a wide range of vocations and have some, you know, kind of practical experience starting in CPS, and then extending that to whether you go to city colleges, whether you go to the trades, whether you go to you know, another 4-year institution, that you have that kind of pathway, and that employers recognize the multiple pathways and have multiple doors of entry.
You know, I think that formal schooling, that is important, and you know, it's not really so much a focus of my work, although it definitely impacts our communities. But I also point out initiatives like, you know, there's so many coding opportunities within community to learn how to code, right? These are the jobs of not the future. These are the steel worker jobs of today, right? There's opportunities to learn about financial literacy. There's a young man who graduated a couple of years ago from high school. He started a program called Rapunzel, teaching about financial literacy and how to invest in the stock market and things like that. Things that were foreign concepts, right? But if you look at what's happening in the stock market now, and you want to talk about closing that wealth gap, not only do you have to know how to read, write, arithmetic, but you need to understand how to invest and how our financial systems work as well. So that's another part of what we need to think about in terms of educational opportunities.
Right. Maybe as a dedicated humanities person and as a member of the art faculty, I would also make a push for the importance of disciplines and fields and education that unleash our radical imaginations, you know, as sort of people who are able to envision the future societies and also to have an understanding and analysis of history and things like that. So I definitely hear the sort of emphasis on sort of that which is practical, but also I think a capacious definition of what is practical is probably also needed. Gloria, did you want to jump in on the sort of education question?
Yeah, you know, I think obviously We Rise doesn't focus on education, but we do think about with the corporate community, and in particularly 525, you know, 25 corporations stepped forward a year ago to really look at their practices in building greater equity. And among them, you know, as Samir mentioned, it was to re-look at what are the qualifications for positions. Are they simply putting a 4-year degree on a position description for the sake of having it there, or is it really necessary? And that opens up a lot of possibilities. And I think when we think about the work, we also think about how important it is for parents to have work that is flexible, allowing them to get their kids to school, allowing them some grace when their child is sick and they need to leave a little bit early. As companies really think about how their practices affect parents, we can really see how it strengthens families and gives greater opportunities. And a number of the projects we're funding also include in their larger projects specific kind of areas of focus on after school education, after school opportunities. You know, Latino Progresando, for example, is partnering with Lincoln Park Zoo so that they make sure that they have really meaningful after school programs. And we've also got to focus on childcare. So you can't have a child that goes from school and goes home and there's no one there, there's no childcare, there's no one to help them with their homework. Parents are working, they need to have time to get home and make dinner. So we, as a city, we really need to think about the impact of quality childcare on education. We have to have both the work that goes on in the schools and the ability for parents to feel confident that their children are cared for after school, in that gap before they get home, in ways that continue to strengthen their imagination. That's the time that is a wonderful time for them to engage in art and in area that is of interest to them. And so the more that we can add that into each one of our communities, the better the entire educational opportunity is for the child.
Speaking of which, real quick, this is the election day for your local school council too. So that's one way to have an immediate impact. Go vote for your local school council representatives.
Yeah, thank you very much for saying that, Gian. And Gloria, I love the way that you're linking these issues, which I think is so important, that you can't sort of talk about jobs without talking about childcare. We can't talk about education without talking about housing, right? Like these things are deeply, deeply interconnected. There's a question to us about how the public sector can actually support the capacity and growth of civic infrastructures within neighborhoods in order to bring residents and a more expanded sort of stakeholders to the table to actually talk about futures. I know that Gian mentioned the whole participatory budgeting process and like the people's budget that Chicago United for Equity, for example, helped to sort of put out into the whole city. Like, what are ways, Samir, that the city of Chicago can actually create spaces for communities to participate in planning their futures?
Well, I'll use Invest Southwest as a template for this. But in each of the Invest Southwest communities, first of all, they were selected because most of them had a quality of life plan that they had done with LISC or some other institution, and so they had a forum already set with key members of the community, key organizations, key stakeholders. And so with Invest Southwest, we formalized that where the city has helped fund a corridor manager in that community that comes from the community, that's not a city worker. And on a monthly basis now, they're getting that roundtable together of the key stakeholders in the community to help inform all the plans that happen, whether it's what will happen to the streetscape as it's redone, what will happen with these vacant lots, where should we direct investment, with TIF dollars or other funds. So I think that's a really good model as to what we could try and replicate in other parts of the city. If you look at a city like New York, they have regional planning districts with regional planning councils that are very community led. And that is a model that I would expect us to drive more towards, especially now that we're undergoing the first citywide planning effort in 50 years. So after the Burnham Plan in the early 1900s, then we had the city plan in the 1960s. Now we have the We Will Plan. That's the first comprehensive plan in modern times. And I think that will be, a key finding that probably comes out of that is this need to empower voices at the local level as a part of regional and local planning.
Great. Yeah. And I'll just sort of put out there as a historian who's, spent a lot of time on the Burnham Plan. One thing that the Burnham Plan didn't include was any provision for housing, as sort of as an economic, sort of an aesthetic beautification of the city. He just never even considered housing of the people who most needed it as part of the plan. And so hopefully as we move forward, we all can push for a much more inclusive and equitable and accessible plan for our city. All right. We're at the sort of end. We have one more minute. I just want to give each of you the chance to sort of throw out into the Zoomosphere one final thought. Gloria, can we start with you?
I think what I would say is this is an inflection point for our city. We have an opportunity with a real focus on equity. And we've talked about a lot of different sectors. We've talked about business, philanthropy, education. It's really important that all of us think about how do we drive the city in a way that is more equitable, because we will be together and we will be stronger together than we ever could apart.
Great. Gian. Uh-oh, muted.
Sorry about that. I think I would break it down to the things that I can do, that you can do. And again, I break it down to peace, health, and prosperity. What are the things that we can do? I'm hard on the city, right? But I'm hard on the city because I feel like I'm doing my part to achieve peace, health, and prosperity. So I would ask all of the audience members to think about that as well.
Great. Samir?
Well, I think, the experience of the past 2 years, we've all been taken completely out of any comfort zones we've had with the experiences of the pandemic. And so what I would say is, I think it's important that all of us go and visit a neighborhood and engage with people in a place of the city that we've never been to. And whether that's eating at a local establishment, shopping at a local establishment, connecting with your friends or people in your network who might live in a different part of the city that you've just never been to. I think our city will be a more unified place if more of us did that. And so that would be, my call to action.
Yeah, here. Also visit a museum in another neighborhood that you maybe never would have gone to. I just want to end with the beautiful words of Arundhati Roy, the writer and activist, who I think says something so prescient, and it's been quoted and requoted, but I think we can never hear these words enough. She writes, historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It is a portal, a gateway between one world and the next. We can choose to walk through it, dragging the carcasses of our prejudice and our hatred, our avarice, our data banks and dead ideas, our dead rivers and smoky skies behind us. Or we can walk through lightly with little luggage, ready to imagine another world and ready to fight for it. Thank you so much, all three of you, for fighting for the world that we all want to live in. I appreciate you. And I'm going to back to Joe Horwath now. And thank you so much, UIC, for creating this urban forum for us to talk to one another. To you, Joe.
Thank you, Lisa, and panelists for that engaging discussion. I wanted to share a few remarks that summarize what we've heard today. But before closing, I know this is a virtual event, but I think it's still important to do a land acknowledgement. We would like to acknowledge that the University of Illinois at Chicago resides on traditional territories of three Fire peoples, the Ojibwe, Odawa, Potawatomi, purchased after 2.5 years of open warfare, decades of violent encroachment, and the defeat of a pan-Indian movement to keep settlers out of the Great Lakes region at the Treaty of Chicago in 1821, receiving their final payment before moving westward in 1835. The area was also a site of trade, gathering, and healing for more than a dozen other native tribes. The state of Illinois is currently home to more than 75,000 tribal members, and the Chicagoland area is currently home to one of the largest and most diverse urban native communities in the U.S. Illinois is also the territory of the Ho-Chunk, Miami, Anoka, Menominee, Sac, Fox, and their descendants. By making a land acknowledgement, we recognize that Indigenous peoples are the traditional stewards of the land that we now occupy, living here long before Chicago was a city and still thriving today. As we work, live, and play on these territories, we must ask what we can do to right the historic wrongs of colonization, state violence, and support Indigenous communities' struggle for self-determination and sovereignty. In that spirit, the conversations in both panels this morning have given us a glimpse of the possibilities with regard to seizing the opportunity that a crisis like the COVID-19 pandemic presents with regard to fundamentally transforming structures in our societies and our cities that create and sustain disparities. We heard from panelists in panel 1 that a seamless integration between human services and public health is key, especially for supporting the most vulnerable whose day-to-day health is dependent on those supports. We also heard that policies can mask systemic disparities by providing just enough rather than what is truly needed. To address inequities, we need to prioritize equity across government and all institutions, including how we understand and gather data. We also heard that responses to crises like COVID-19 need to meaningfully engage communities, such as engaging the full range of types of community partners, including regular and culturally appropriate communications through trusted messengers. The themes we heard in panel 1, we heard again also in panel 2 in different ways. It's important to keep the understanding of how our challenges are interrelated and intertwined, for example. That sense of Ubuntu is the foundation of overcoming disparities. We also heard how decision-making matters. For example, the recovery presents an opportunity to reframe community challenges as assets rather than deficits, to find ways to include communities in the decision-making, first just by a basic thing, by listening, in a way that informs the recovery as well as the recovery itself. Finally, we heard that building muscles for equitable investment in communities is crucial, such as the partnership between businesses, communities, and philanthropy in the example we heard discussed in panel 2 from the initiative Invest Southwest. The need is crucial also for corporations to step up as well to promote equitable investment. From all of these great points, the commentary and questions of the moderators, I hope you found something that was shared today that was either actionable, inspiring, or at the very least hopeful with regard to building just and resilient communities. I'd like to thank all of our panelists, our moderators, our advisory committee, Chancellor Emeritus, President Preckwinkle, Interim Dean Merriman, most importantly, the planning team, Jenny Sweeney, Carla Bailey, Marty Gutierrez, Jennifer Woodard, Brian Flood, Norma Ramos, Sheila Brown, Jessica Cortez, Haley Sanders, and Jonah Bergenzarian for their hard work on this event. Thank you all for joining us today. Enjoy the rest of your day, and we look forward to seeing you, hopefully in person, at the next Urban Forum. Thank you.